So, first and foremost, welcome, Mary, and thank you for being the keynote speaker at our upcoming conference later this year. Our conference is titled Adapting, Building, Changing, Rethinking Normal in a Post-Pandemic World, which is very much in line with your current research. Why don't you start with telling us a little bit about yourself and your relevant qualifications?
Thanks very much, Marissa, and I'm really delighted to be speaking at the conference this year. I started out my career as a family therapist working in children's mental health centers in Ontario and made a shift into policy uh, early on in my career, and I've worked with different levels of government, with Indigenous organizations, and a lot of my focus has been on uh, supporting the mental health sector to develop and address a lot of the equity gaps that I saw when I was working as a frontline therapist. So, one of the places that I've done a fair bit of work is with the Mental Health Commission of Canada, where I'm currently the Director of Policy. I went back to school about almost 10 years, 8 years ago now, to do a PhD, and I focused my dissertation research on access to psychotherapy. So I have a lot of interest in this topic. I also teach policy courses at Carleton, including one on mental health and substance use policy. So lots of interest, and the issues around access to mental health services, in particular psychotherapy, are near and dear to my heart. So my research interest in uh, looking at the needs of the mental health and substance use workforce come from a lot of different roots.
Great, that's wonderful. So that actually leads perfectly into my next question, which is your study is titled Mental Health and Substance Use Workforce Capacity to Respond to COVID-19. So why did you decide to research this topic?
Thanks, Marissa. So my co-investigator, Dr. Ivy Bourgeot, who's based at the University of Ottawa, she and I had been trying for a number of years to get some research funding to look at the capacity of the mental health and substance use workforce. And with the pandemic came some opportunities for research funding that were targeted to mental health and substance use. And so we decided to put in a proposal for funding to look at how the pandemic was impacting the capacity, not just of the mental health workforce, but also the substance use workforce, given how closely interrelated mental health and substance use are, and the two workforces are as well. So with the pandemic, we could see, there was a lot of discussion early on, and some of this is bearing out that the shadow pandemic, the likelihood of the mental health and substance use impacts being delayed and complex. And we're seeing certainly the level of symptoms of depression and anxiety in particular have been up across the population. And it's the mental health and substance use workforce that are really critical for responding to that emerging need. And yet they've been very absent from the policy conversations about the response to the pandemic, including the response to the mental health impacts of the pandemic. So a lot of this research is designed to shine a spotlight on what is a very hidden workforce in terms of reaching the attention of policymakers.
Yes, for sure. So very topical right now for a lot of different mental health professionals.
Mhm.
So what are some key areas of focus that you both chose for the study?
Absolutely. So the study is what's called a mixed methods approach. So we've got uh, uh, quite a robust review of available research literature, and also the kind of documents and reports that are more promoted through governments or think tanks or professional associations to really see if we could dig deep and unearth some gems of research and policy thinking around the capacity of the mental health and substance use workforce, both before the pandemic, but also during the pandemic. And while, as I mentioned, it's not a topic that gets a lot of attention, we wanted to make sure that we were pulling together what was available so that we could synthesize that. We also did a survey that went out. We had, I think, over 3,000 respondents across the country looking at how the impacts of the pandemic, how the pandemic affected the capacity of the mental health and substance use workforce on different fronts, and how the increases, like what were the factors that drove, maybe for some people, the capacity increased during the pandemic, and for others it would have decreased, and what were some of the reasons that people could identify for those increases and decreases, and then how did those vary across the different types of occupations. So in the mental health and substance use workforce, we can call it one workforce, but really it's multiple workforces. We have different types of psychotherapists, counselors, counseling therapists. There's also psychiatrists, occupational therapists, mental health nurses, addiction counselors, and so on. So and social workers, and the list goes on. So were there any noticeable differences in how the pandemic affected the capacity of different occupational groups? And from a policy perspective, could we notice anything, for example, about whether the extent of availability of regulation for different provider groups might have contributed to some of those differences, or the stability of the funding base? Is the service covered through provincial insurance plans or not? Is the type of provider recognized as eligible through third-party insurers, covered through workplace benefit programs, and so on? So those were some of the issues that we set out to explore with the survey. And then the other things that we did were key informant interviews to get a bit of a deeper understanding of some of those issues, and also we held a policy dialogue in June with over 60 people, stakeholder groups, government representatives, and so on, to help us prioritize some of the key findings and implications and next steps. So it's been a busy year. We were supposed to be done by the end of August, and it will definitely bleed a bit into the fall, but we finished the data gathering and some of the analysis, and we're just continuing to fine tune it now into the fall.
For sure. I feel like that is very common with research too.
Yes,
You have a deadline and yet things happen.
Yes, absolutely. And with the pandemic, it's been quite an interesting project. So there's actually 8 or 9 people on our team, and we're all working remotely, connecting once a week just to kind of take stock. We have researchers at the University of Ottawa, at Carleton, at McGill, and at the Mental Health Commission, all working together. And we also have a group of advisors from across the country. So it's been a complex project done over a short period of time under interesting circumstances with the pandemic affecting everyone. So.
Wow, for sure. Yes, that's quite the team brought together for this research.
Yeah, it's been great. And the fact that we had mental health and substance use has been really, I think, one of the ways in which the other way in which this project has been breaking some new ground is to look at those needs together rather than separating them out. And the fact that we've been able to bring all the different provider groups together as well has been something I feel really good about, because the sector has kind of got a bit of a reputation for having turf issues between different provider groups. I don't know if you'd agree, Marissa, or if the folks who are watching this would agree, but we had a lot of collaboration, a lot of coming together in good faith, and to try to, like I said, shed light on the needs of this really important part of the healthcare system.
So last question from me, but certainly not the least, is what will you be discussing at the keynote address?
Absolutely. So I'm excited to share some of the findings from the study, and well, I'll be fine tuning them between now and the conference. Some of the emerging findings that we've identified so far, that overall, well, for some folks, capacity did increase during the pandemic. On average, there was a decrease, and we saw that that decrease was greater for female providers and for some provider groups, in particular addiction counselors. We found that the response from providers was strongest among those we know the least about, those who are least regulated, who have access to the least amount of public funding. So we're talking here about peer support, about the range of counselors and therapists and psychotherapists. And while they're regulated, RSWs as well responded very strongly to the survey. So it was as if people wanted to be recognized, wanted their experience to be documented, that we got that strong response from people that we don't know as much about in policy circles. Another finding was that with the pandemic, there was some windows of opportunity for increased recognition, whether it was because it accelerated efforts to strengthen regulation, say for psychotherapists or counseling therapists in provinces where work has been underway to get that moving, or whether it was an expansion of eligibility under private plans, so third-party insurers. But that within that, there's a bit of a risk that the private sector might pick up more of the increase in capacity and leave the public sector side of the system more short than it currently is as far as human resources. So something to keep an eye out for. And then the last thing that we saw in particular in the research literature was that there's a need, like the pandemic, because of the inequities in how the mental health and substance use impacts of the pandemic have been distributed, and even before that, how the pandemic itself has hit some communities harder than others, whether it's racialized communities or low income communities, that the need for mental health and substance use capacity and competency to provide tailored services, culturally safe services, et cetera, and language specific services to communities that were hard hit by the pandemic was really reinforced. And we saw that in particular in some of the rapid research that's been coming out through the course of the pandemic. So those are some of the things that I'll be talking about, including, some of the policy implications. So the need for better data, the need for more regulation, the need for data about the specifics of the mental health and substance use workforce, which we just don't have very much good data about it, and the importance of recognizing the needs of the mental health and substance use workforce and what a pivotal role it plays in the healthcare system. There's been a lot of talk about the mental health needs of doctors and nurses who've been incredibly stressed and strained in responding directly to COVID, and that's absolutely critical and important. Yet the risk is that in focusing on that priority, that the needs of the mental health and substance use workforce may continue to be overlooked. So I really want to bring that message to the conference as well.
I think hearing all the results and the further discussion will be very interesting, well, for myself, but for all the conference attendees. So I'm really looking forward to your keynote presentation.
Thanks very much, Marissa. And I'm looking forward to people's questions and feedback as well. So
yes, for sure. So thank you very much, and can't wait to see you for the presentation.
thanks, Marissa.